has actually come down from the federal government to the state level. The legislators at that point in time have decided what to do with those monies. And the 2010 legislators approved the low-income pool funds to support projects designed to enhance access to primary care, which is around $34 million. We did put in our proposal the end of October. By the end of November, we still heard nothing. By December, we heard nothing, and then we came back from Christmas and found out we had received LIP funding. We received $750,000 to our health department to provide primary care services for 3 different purposes. One is to reduce potentially avoidable emergency room visits, which will help our local hospital too with their funding situation. The other thing that this grant is going to help our community is that will be an expansion of primary care, which will be after hours. We will actually run our clinics now from Tuesday through Friday. We've been there from 8 to 5, but we will extend those hours from 5 till 8 o'clock at night. And then on Saturday mornings, we will actually be there from 8 to 12. Now, that won't be providing our other services like family planning, childhood immunizations, those things like that. It's just for primary care, to keep people out of the emergency room that have been going to the emergency room for sniffles, for colds, for, urinary tract infections, that kind of thing. So we are going to be extending our hours for those types of situations from 5 to 8, Tuesday through Friday, and the Saturday mornings. We will continue our other services, Monday 8 to 5, and the other days during the week from 8 to 5, actually 7:30 to 5 is when we're there. So we'll continue all those services, our dental care, our WIC, our Healthy Start, environmental, everything else that you're normally accustomed to that we do. So those are some of the things that came along with the grant funding. This will start March the 1st, and I wanted you all to know about it because you're going to hear about it in the community. We've already hired about 10 people, OPS, part-time workers, to come in and work those hours to help us. I've contracted with some local providers, healthcare providers, nurse practitioners, and physicians to come in and to work those hours for us. We're real excited about it because there's not another provider. There may be one that's putting in maybe an extra hour during the week in the afternoons, but not extending it to 8 o'clock in the evening and also on Saturday morning. This was the same type of grant that you heard that Bay County had gotten. I don't know if you all heard that Bay County and Walton had gotten it before Christmas, and there was a big thing on the news about it, the primary care funding. This is the same thing we got. We just, for some reason, the information did not get out to the media like it did for Bay and Walton. So we're going to start putting a big push, putting the information in the paper, because we, of course, want our MS working with us and some other groups working with us to let the community know that we are there after hours to provide that care at our health department.
Holly, can I ask you something while we're right there? Does that have to take place at the health department? If I said, is there any way you could come to the west side of the river one day a month or whatever?
We could look at that if we had a facility there to
City
provide
Hall,
those services. We have in the past, years ago, done a few things over there with our WIC over at the Ponce de Leon, talking about the City Hall in Ponce de Leon. We still send Healthy Start over there, but we're not doing any primary care. But we can look at that. That might be an option for us to expand, which will lead me to the next subject, the Federally Qualified Health Care Center. I've actually put in the proposal for that, and that was submitted the 1st of December. If we do become what's called a Federally Qualified Health Care Center, we've talked about this in the past when I've been here, that's an area we can look at, extending our services like that. So this is growth. Now, you're probably thinking, why are we looking at primary care? The governor's saying, we don't think that CHDs need to be in primary care and that kind of thing. You were talking about legislative day. I would love to take some time to talk with whoever's going about the health side of it, because we've got some real issues. I don't know if you're aware, but they're very interested in taking primary care out of the health department. If that happens to our county, we're going to be in hot water because we have no one really taking care of our indigent population. And they will flood, everybody will go to the emergency room and flood the doors. Now, we are good with this LIP project up until December. If our legislators in the next few months make the decision that they want this LIP funding to be used like it has been used in the past and continue these projects, we may be good for the next year, the next year, the next year, but for right now, we know this project is good up until December. For a federal qualified health care center, if we do receive that funding and receive that status, then we can continue that, and we basically just go in every 3 years, and we submit another grant proposal to continue our federally qualified health care status, and at that point in time, that continues, because that's federal government money, and that's where Obama has put a lot of money, President Obama has put a lot of money in federally qualified health care centers. And as you all know, we do not have one in Holmes County. There's not one in Washington County. There's one, a certain area, well, there's one that's actually coming out of Bay into Washington.